Hello, hello. Welcome everyone to Your Lane Talk Show with your coach Trish Hanna, broadcasting from Nassau, Bahamas. Thank you for having me a part of your day. Allow me to be a part of your day today. I am blessed to be a host. I am blessed to be able to bring to you, things that we deal with as women on a day-to-day basis. This particular show, for those who are tuning in for the first time, was created to educate, empower, and encourage women of all ages. We talk about every single thing. And as I've always stated, although this is a women's talk show, we have a lot of men that tune in and listen as well. Now, this month, of the month of February, the love month that people call it, this month we'll be focusing on real conversations about life, love, and everything in between. Last week, we had two couples on the show to discuss the topic Undefiled, Breaking Taboos About Sex in Christian Marriages. That was episode 120. That show was fire. All right. I still have people coming to me. Yeah, child, I do this. And I'm like, thanks, mom. Thank you. I what I love about the show though, that it is encouraging, it is empowering, it is educational, and I love the fact that people are gleaning from it. And that's all it is. It's just me being, as I was telling my guests earlier, me being obedient to God, doing this particular show so that others will get whatever answers that are needed for those who may not be able to hear it in churches or other public forums. All right. So we do the taboo topics. We do every single thing. We inform, we educate, and in most cases, we give you the consultation free of charge. All right. So I want to get right into it. We know that this is Valentine's season, as I said before, and some people call it the sweethearting season, right? Yeah, I leave that right there. All right, romance is still in the air nonetheless, but while hearts are fluttering and emotions are running high, there's a side to love that we don't really talk about like that, and that's our sexual health. With increased intimacy comes responsibility. We have affairs, casual encounters, and even committed relationships can carry risks when it comes to sexually transmitted infections. Now, today we're having an open and honest conversation about protecting ourselves and, of course, your partner. Joining me is a medical expert who will break down the facts on STIs, how to prevent them, detect them, and have those tough but necessary conversations with your partner. All right. Because true love isn't just about passion, it's also about protection. All right. So share this with someone who needs to hear it. And let's dive into the truth about safeguarding our sexual health. Your lane has various ways that we can be heard. As you know, the radio, which is star 106.5 FM dial, channel 976 on cable. And you can watch us live on Facebook on Your Lane Life Coaching Facebook page or YouTube on Coach Trish Hanna's YouTube page. And you can also, for those who have the In Faith app, you can watch us live on the In Faith mobile app. All right. Your Lane episode 121. Love and Protection, Safeguarding Your Sexual Health is brought to you by John Shoe Store and Accessories, Your Lane Life Coaching, Emmanuel Medical Center. Take charge of your health with Emmanuel Medical Center. They specialize in annual physicals, health certificates, and the management of hypertension, diabetes, and cholesterol. They also provide child and adolescent health care, primary health care for adults, screening and management of sexually transmitted infections, and diagnosis and treatment of mental disorders. For compassionate and comprehensive care, call Emmanuel Medical Center today at 393-9355. Emmanuel Medical Center, helping you achieve wellness. Y'all, we're also brought to you by the Perfume Bar. Celebrate your love with their perfect pair promotion. Shop and save 15% off your second fragrance going on now until the end of February. And lastly, we have also brought to you by Dairy Queen Bahamas, DQ Bahamas. No, not lastly. There's another sponsor. Praise the Lord. DQ Bahamas is asking you to set sail on the ultimate Valentine's Day experience. Dairy Queen has partnered with Seahorse Sailing Adventures to give you a chance to win a sunset dinner for two. Grand prize includes 2 to 3 hour sunset sailing, delicious dinner drinks, and dessert. To enter, just spend $25 or more at DQ and place your receipt in the raffle box. Winner will be announced on February 12th, 2025. Celebrate love with an unforgettable evening. And of course, Lysol disinfectant is also our sponsor. Sickness can spread fast, but with Lysol, you can go into protect mode, right? Nothing kills more viruses on more surfaces than Lysol disinfectant spray, distributed by Thompson Trading. So let's get right into it because I'm excited. We have a lot of information to cover today, but it's going to be a fun show, all right? Enlightening show. And I encourage you to tag a friend, tag a single and a married person, all right? Because this is for all of us, all right? We have in studio a wonderful guest, very energetic, very exciting, and he's excited to share today. And that's none other than Dr. Norad Morgan. And he obtained a Bachelor of Science degree in biochemistry and a Bachelor of Arts degree in music from Beloit College, Beloit, Wisconsin. He studied medicine at the University of the West Indies, Mona, Jamaica, and receives a Master's of Science degree in immunology from Trinity College, University of Dublin, yeah, in the Republic of Ireland. Dr. Morgan is presently the clinical medical officer in the Department of Immunology, Infectious Diseases in the Ministry of Health and is the CEO of Emmanuel Medical Center, a proud sponsor of the show. He is married to Dr. Michelle McLean Morgan, and the couple has two daughters. Welcome, Dr. Morgan. Thank you for
having me,
accepting the
Trish.
invitation to your
Thank
Lane
you,
Talk
thank you,
show.
thank you.
Listen, now before we start, let me just let you know whenever we find out that there's a guest on our show who is married, we'll be like, hey, you got to pick up your wife. You
Oh
got to pick up
yes,
your
oh
spouse.
yes,
I want to give you a couple seconds just to
yes.
salute her on your Lane Talk show
Well,
today.
I salute Michelle. She keeps me focused.
Yes.
She is hard on me sometimes, but
Mm-hmm.
she loves me dearly, and
Mm-hmm.
she only wants the best for me.
Yes.
And I tell couples all the time, marriage ain't easy,
No.
right? And marriage is a discovery. So every year I'm getting better. Last year I think was my biggest epiphany moment
Yes.
where you do some introspection and you look at yourself.
Of
But
course.
I love my wife. She has been very supportive of me. She keeps me grounded. She de-stresses me,
Mhm.
and I thank God for her.
Amen. Amen. Thank you, Dr. Morgan, for allowing us to take an hour and a half of your time
Yes.
right here on your Lane Talk show today. So God bless you and God bless your marriage.
Thank you.
So, Dr. Morgan, let's get into it. Now, I said Dr. Morgan because for those who didn't hear, she's also a doctor. All right. So we'll say Dr. Michelle.
Yes.
Thank you for allowing us to have Dr. Morgan here on board with us. Now, getting straight into it, we want to know what are some of the most common sexually transmitted infections today? And of course, how are they spread?
Yes. So some of the most common sexually transmitted infections include chlamydia,
Mm-hmm.
gonorrhea. I've seen an increase in syphilis,
Ooh.
and trichomoniasis
Mm-hmm.
is tops that list also.
Mm-hmm.
And then we have to also think about HIV. It may not be the most common,
Right.
but it is something very significant,
Mm-hmm.
and it is something that I'm sure we'll get into on this show.
Mm-hmm.
But gonorrhea, chlamydia, syphilis is on the rise, trichomoniasis, and then there are other STIs that are not so common, but now and again we see them.
So you're able to break down each one of them to say, what are some of the symptoms and how they
Yes,
can be.
some of the symptoms.
Right.
So symptoms may vary. They may be very similar in both sexes,
Mhm.
but they may vary to an extent.
Mhm.
As Dr. Michelle always say, and she broke this down for me one day, that a lot of the STIs may not be seen in women
Right.
as quickly or clinically present
Right.
in women as quick as they would in men.
Mhm.
Because as men, we have sex and we urinate out of our penises, out of the same organ.
Mhm.
And so a lot of the symptoms may present quicker in men. So within 4 to 5 days, if someone has chlamydia or gonorrhea, for example, they may go to the bathroom. They may wake up in the morning and they may see a discharge on their underwear.
Mm.
When they go to the bathroom to pee, they'll feel a burning sensation. Sometimes it's very uncomfortable. I had a patient who described it to me, Doc, it feel like a million needles sticking me.
Ooh,
Yeah.
wow.
Right. And so it presents within 4 to 5 days. It may
Yeah.
go up to a week, but usually within 4 to 5 days, sometime even within 3 days of an unprotected sexual encounter, a man may say,
What
Doc.
color is the
So
discharge
the
in the
discharge
underwear
is
for the
usually
men?
a yellow discharge. I've even seen it green in
Ooh.
color. So once they see that, they know something ain't right. Right. And so that's how a man may present. He may have fever, he may have lymph nodes in the groin, he may just not feel well, right? But it's usually the discharge and the burning when they urinate, or that uncomfortable irritating feeling even when they're not irritating. And so that alerts them to say something is wrong.
Right.
With women, they may take a little longer to present. Now, women could still have a discharge, and it may be, a foul smelling discharge. They may have fever, lymph nodes swollen. And I'm talking about gonorrhea and chlamydia,
Right.
some of the
Now,
more
hold on
common
now. So
ones.
I know that there are certain things like yeast infections
Yes. And so you have to
vaginosis.
differentiate
Right.
that,
Okay.
because
Yeah.
yeast infection in women, that's pretty common.
Right.
But that's not a sexually transmitted infection,
Right.
nor is bacterial vaginosis.
Yes.
So bacterial vaginosis is where the flora of the vagina may change.
Yeah.
And it could be with the use of toys, use of condoms, a new sexual partner, and they may have a foul smelling discharge, but it's not sexually transmitted.
Right.
So I have to always make that distinction with women.
Differentiate that.
Yeah,
That's what I
because they'll
wanted to.
come frightened.
Thinking that it is
Yeah,
STI.
and that is why
right.
it's always good to present to your healthcare provider.
Yes.
So you ain't got a spaz.
Right.
You know,
Because I had a gynecologist on that was trying to differentiate or try to educate us with that as well. But I just wanted you to reiterate, because
yes,
you could present as discharge in
yeah, and it
the
doesn't have to be sexually
right.
transmitted.
Okay, so I just wanted you to
A sexually
clarify that
transmitted infection.
Okay,
Yes.
so
Yeah.
let's talk about what additional
Women
right.
presentation. So you would and so they may have a discharge, but it may take longer to spot. But the trick about it is, Trish, a lot of women who have chlamydia or gonorrhea present late. Chlamydia, a lot of the chlamydia we pick up in females is if they come into the office and just do a random sexual screen, which is good. And I promote that with all your, physical exams, whether it's insurance or not insurance. I always invite the patient, would you like me to also add a sexually transmitted infection screen with this? It may not be covered under the insurance, but I think it's important because
Yes.
sexual health is important.
Yes.
And so I offer that. And I don't care what age you is. You could be the deaconess in the church.
Yeah.
I can still offer that opportunity for you,
Right.
because a
Yes.
lot of people have STIs and don't know,
know.
including
Yeah.
females. A lot of them are picked up at their antenatal screenings.
Yes.
And that's how we know, right? But the danger in that, especially with chlamydia, the asymptomatic presentation, and I tell young people all the time, whether I'm speaking at youth groups, church groups, wherever I'm, high schools, junior schools, is that you can have chlamydia and you could have chronic inflammation going on in the fallopian tubes, scarring. Anytime you have chronic inflammation, because you have an infectious disease going on, so the immune system is trying to clear it, there's scarring of the fallopian tubes. And scarring of the fallopian tubes is bad news. It leads to infertility.
Yes.
So I tell young people all the time, the sexual decisions you make, 16, 17, 18, could have consequences when you're trying to conceive in your 20s and 30s.
Absolutely.
Right? Because it goes undiagnosed. If you don't know a sexually transmitted infection is there, it can't be treated. And it's an easy treatment. A lot of these sexually transmitted infections are curable. Syphilis is curable.
I know
Chlamydia is curable. All these curable.
You're going ahead of me.
Yeah.
You're going ahead of
Yeah.
me,
Yes.
which is good though. But
Yes.
so so the presentations, and that's what you got, right?
Yes. Yeah. Now, other presentations,
Yes.
syphilis is very tricky. The syphilis goes in stages. So you
Okay.
may have primary, secondary, tertiary,
Mhm.
right? The primary stage in men and women may just be a little innocent bump that may present on the head of the penis. Men may think, okay, and Trish, you gave me, I could talk freely on this show, right?
Yes, sir.
Some people may say, oh, I just get a little cut from sex
Right.
or from masturbating too vigorously,
Yeah.
and they see a little bump. It's painless. This is primary syphilis. we call it a chancre. So it may be a little sore. It's painless, right? And you may only see it, you may only notice that it's there if you look down, because it may be painless, right?
Right.
And so the trick with that is it goes away. It goes away on its own. And so you'll think, die nothing, but
Yeah.
that's a primary. We call it the great masquerader, syphilis,
Wow.
because it's very tricky. So it goes on its own, and you
Mhm.
think everything dandy.
Mhm.
Then the secondary stage, you may start to have these spots in the palm or the bottom of the feet, the soles of the feet.
Ooh.
Secondary stage.
Okay. Mhm.
Tertiary stage can affect your heart, can affect the neurological system. There's something called late syphilis, neurosyphilis. So you see the consequences if
Yes.
it goes untreated. If you don't know you have it, you can't treat it, right? And it can affect your heart. Syphilis is one of those sexually transmitted infections that could also cause dementia.
Wow.
So in dementia patients, that's one of the tests, the blood
Mhm.
tests that we use to, to screen.
Mhm.
And so
Mhm.
syphilis has stages, and it has, and I always use consequences with my young people. There are consequences, but it is a curable disease. Penicillin G
Mhm.
treats it, right?
Mhm.
Usually 3 shots cures it.
Mhm.
It
So for the ones that you've listed so far, which one is the most common in the Bahamas?
Well, I'm starting to see a lot. I think chlamydia, I think worldwide, chlamydia is the most common bacterial STI.
Mhm. Mhm.
But believe it or not, I know we're jumping around. The most common STI is HPV. We don't talk about HPV a lot.
No.
You know,
No.
HPV um, is almost ubiquitous. Everyone, probably every
Have.
young person would probably
Yeah.
have come in contact with HPV, especially when they get to college.
Mhm.
Remember, HPV causes cervical cancer,
Mhm. Mhm.
causes cancer of the vagina,
Mhm.
it can cause benign conditions like warts on your hand. It could
Mhm.
also cause penile warts.
Mhm.
It can cause throat cancer
Mhm.
from oral sex,
Yeah. We
right?
go in
Oral
there.
pharyngeal cancer.
Yeah.
And so HPV, but the thing about it, Trish, it's a very, well, you shouldn't have your favorite STI pathogen,
Right.
but it's the most interesting to me because if you have a healthy immune system, you can clear HPV within 1 to 2 years. Now, pap smears in females are usually done at the age of 21
Yeah.
because I think if you do pap smears before, most people would have HPV, right?
Mhm.
We know that someone has HPV infection indirectly because when you do a pap smear, the
Mhm.
cells change. They may not necessarily be cancer,
Mhm.
but the cells will head there,
Mhm.
right? And that's the importance of having a pap smear after 21 in females
Yeah.
if you're sexually active,
Mhm.
especially if you have multiple partners, right? Especially if your partner have
Mhm.
multiple partners, you're
Mhm.
at risk, right? So a pap smear is very important because the pap smear can now see the changes the cells have from normal straight to stage 1 cancer.
Mhm.
That's why it's so important because the obstetrician gynecologist can actually intercept and treat you when those cells are in their precancerous
Primary. Yeah.
stage.
Mhm.
And that's why a simple pap smear could save people's lives,
Mhm. Right
right?
there.
So HPV is the most
So if you
common.
haven't taken your annual for the year, it's only February, but you still try
Yes.
and get it done. All right. For
Yeah.
those who haven't
Yeah.
done so
And I know we
as
haven't
yet.
talked about herpes,
Hmm.
but
Go
herpes
ahead.
is another one
Yes.
I'm seeing more of. Remember, herpes is not curable like HIV.
Right.
It remains in your system, right? In your neurological system, and it sits there dormant.
Hmm.
When you become immunocompromised from stress, chronic alcoholism, you may be diabetic, you may be HIV positive. Once you may be on chemotherapy,
Hmm.
right, for cancer. When you become immunocompromised, you could get herpetic lesions on the mouth or the genitals. Herpes simplex 1 is on the mouth or the oral, and
Hmm.
genital herpes is herpes simplex 2. Those lesions that you get, you can know you have herpes. They're
Wow.
very shallow lesions that present on the genitals that
Mm.
burn,
Ooh.
right? So if water hits it or urine hits it, there's shallow lesions that are very painful.
Hmm.
Even clothes, when clothes sticks onto
Rub
those,
it.
it can be
Yeah.
very
Wow.
uncomfortable. It's not
I
curable, but it's treatable.
I know that you were saying that you have an opportunity or had an opportunity to um I guess, determine the age brackets for those who have had, you've spoken to teenagers, you've
Yes.
spoken to young adults
Even grade
up
6.
to the sixth grade. Well, thus far, from your experience, what is the youngest age you've encountered or recorded of someone being diagnosed with STI in the
I
Bahamas?
think my youngest in my clinical
Your clinical,
experience
right?
would be 15. I'm sure
15.
other physicians or other healthcare providers would have
Mm-hmm.
seen younger, because we live in a very sexualized society,
Yeah.
and young people are having sex
Yes.
younger. And we have social media, we have pornography. I mean, it's
Mm-hmm.
just a touch on your
Right
phone
there.
and you could
Mm-hmm.
see a sex scene,
Mm-hmm. Mm-hmm.
right? And youngsters are exposed to things in their own homes.
Yeah.
Not all homes are perfect,
No.
and so they're exposed to all these things, and it affects how they behave sexually.
Mm-hmm.
Yeah, but
And that
15 is my youngest.
15. Yeah. And I know you said that most don't show right away. The symptoms aren't really shown right away.
Sometimes they
So
don't.
what happens in a situation um if someone is infected and you know um they don't know that they're infected? So they can continue on
They
with
could
their
continue
sexual,
passing that
yeah,
infection
just
on.
passing it, and
Yeah.
at some point it's going to compromise their immune system or not at all.
Well, some STIs can compromise your immune system. The
Someone
chief
could
of
just
chiefs
go
is HIV. Yeah.
a lifespan with having an STI and
Yeah.
not
Some
know.
people could have STIs and don't know. Syphilis could hide away, because syphilis at certain stages, syphilis is not something you can track. It's a masquerader. So you may not even go through these stages,
Hmm.
but you could still have syphilis, and you're passing it on if you're having unprotected sex.
So certain seasons like Valentine's, because that's the
Ah,
whole
boy.
purpose of me
Yes.
doing this show.
Yes.
Specifically, this was intentional, right?
Yes.
So
Yes.
do you happen to see a rise in cases like this within, like, probably, let's say, the ending part of February and March throughout the years? Is there some type of graph or
Graph or some type
statistical,
of peak.
yeah,
I haven't really paid attention or noticed it though, but I know in my practice now I'm seeing a lot of STIs.
yeah?
It may be because that's what I focus on, but
And
I'm
what
seeing a
is
lot.
the most frequent or the age bracket?
The age bracket. I think the most frequent age bracket is between 15 and 30.
Ooh,
Yeah, so it peaks
they just
between them.
be
Now, older people could have STIs too.
yeah,
And
but
remember, I talk about that tricky syphilis. A lot of
mhm,
older people may have syphilis, because
mhm.
not all us wasn't saints in our younger days.
No.
You could be blood wash, Holy Ghost filled, but sometimes these things still trail behind you.
Sometimes
And if you don't screen,
right.
you don't know.
Yeah.
You see? So that is why I encourage everyone who does their annual, or even if you're not doing your annual, come in and do an STI screen,
Yes.
especially if you're sexually active.
Yes.
You know what you're doing.
Mhm.
You
Mhm.
see?
Mhm. Many people assume that being in a committed relationship means that they aren't as risk,
Here we go.
right?
Here we
They're
go.
not. They're
Oh
not
Lord.
as they're not, I would say, they don't have the risk or may not be as strong as someone who's sleeping around,
Yes.
right?
Yes.
They feel as if they're probably safe from STIs because it's a
Yeah.
monogamous relationship. But what are
Yes.
your views on that? What are the risks of engaging in unprotected sex?
Yes.
And even with a committed relationship, like, what are
So
the
in committed,
chances?
some relationships may be presumed committed. I mean, you have two people in a relationship. Uh, I have situation where you have three people.
Mm-hmm. Oh,
Anyway, we can leave that,
oh,
Trish. You actually let me
hold
focus.
on.
Let me focus. Let me focus. But one partner may not be monogamous,
Mm-hmm.
right? One partner may have multiple partners,
Mm-hmm.
and sometimes the other partner doesn't know, and that's what infidelity is all about.
Yeah.
And it's pretty common. And how do you get STIs? You get STIs from having unprotected sex.
Sex. Mm-hmm.
Even protected, sometimes you can get
Mm-hmm.
STIs.
Yeah, we going there today.
Yeah.
Yeah.
So yeah. So you're not, and I know when I pose that question to patients and say,
Mm-hmm.
"Would you like to do an STI screen?" And say, "No, man, doc. I've been
I'm
married for
married.
40 years.
Ain't
I
nobody
I ain't a
doing nothing.
committed 30 years. I ain't a committed relations. I need that." And sometimes I just leave it there, but
Yeah. But
because you don't want to rock the
yeah.
boat too much. But I'm just thrilled when someone would say, "Yes, I'll do the STI," because I know the
Right.
reality of the
Right.
situation.
So have you been in a situation where someone who is married came in for testing and they discovered that they had an STI?
all the time.
I mean, like, so what are some steps that they can perhaps, I guess, take medically and emotionally? More emotionally because they're already in the clinic,
Yeah,
so they
yeah,
could get all the medical
yeah,
steps. But emotionally, that for two things now. One, for the person who was monogamous,
uh-huh.
but they realized that the only person they've been sleeping with
Yes,
was their spouse.
yes,
And then the second one with the person who came in who know that they've been doing stuff, trying to find a way to tell their spouse that, hey, I have this STI
yeah,
and you perhaps may
yeah.
have it as well.
So emotionally, so sometimes I have to switch roles, switch hats from
Yeah.
the clinician into the counselor.
Yeah.
The two should go hand in hand
Mm-hmm.
anyway.
Mm-hmm.
But yeah, it's, because it's infidelity, it's loss of trust.
Yeah.
And so I encourage the positive patient to tell their partner.
Mm-hmm.
It's not always easy
Mm-hmm.
and it doesn't always happen. When you're dealing with an STI, if your partner is not treated, now I switch into the medical hat.
Yeah.
If the partner isn't treated, it makes sense me treating you.
Mm-hmm. Because that
I
should
mean,
come
I could
right back.
treat you because I should,
Yeah.
but you're going to get it right
Right
back.
back. Yeah.
Because now you don't have the courage. They haven't come in. How you going to now? You have to now have the conversation to say, honey, I've been doing this. I got this. You need to go and get treated.
Mm-hmm.
That's Brigham Bram right there.
As a doctor, are you obligated to call the spouse? No way.
No, because it's doctor-patient
Yeah.
confidentiality. No,
Okay.
no.
Okay.
Now,
I,
in
listen,
HIV,
your husband doing something.
no, you can't
You
do
need to
that.
come in and
you'll
get
in
checked.
trouble. You can get in trouble. But the thing about it is, however,
Mm,
in HIV medicine, we have trained contact tracers
yeah.
who have the skill on how to call in people. Ma'am, we would like you to come in and do some tests. Someone you may have dated in the last so and
Such
so
such.
years
Yeah. Yeah.
tested positive for so and so. We
Mm.
would suggest that you come in and be tested.
Mm-hmm.
And it doesn't pin down the person, because a woman, she going through her head.
All. Yeah.
She going through them years every
Mhm.
day of the year,
Mm-hmm.
right? So we have to protect our clients' confidentiality,
Yeah.
their dignity,
Yeah.
and the safety of their life.
Absolutely.
We take that for granted.
Mhm.
People could lose their lives
Mm-hmm.
if clinicians, if healthcare providers don't handle things like STI, the management, the revealing of results. If we don't
Mhm.
handle it properly,
Mm-hmm.
it could cause a lot of discord with couples. It could even cause violence,
Yeah.
domestic violence.
Mm-hmm.
It could cause death.
Mm-hmm.
So you have to be it's a very sensitive matter, and you have to be very careful
Mm-hmm.
how you handle, how you screen, how you tell the results,
Mm-hmm.
how you manage, how you treat, how you follow up.
Yeah.
Because it could open up some
Yeah.
very uncomfortable
see that.
discussions.
I see that. And even with emotionally, like you said, it's like, okay,
Yeah.
how do you don't just come and say, oh yeah, I see that you have this and da, 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 da. So dealing with, and because it's a women's show, so dealing with a woman who has been monogamous, who
Yeah.
has been faithful,
Yes.
and she comes to you, and then you read off the results to her, and I can imagine perhaps she's probably
Yeah.
just crying
She's
and her
crying.
head all over the place,
Yes.
mind all over the place.
Yes.
So dealing with that now, that takes another but 10-15 minutes just to
Certainly.
console her.
Certainly, just yeah.
So talk to us about that.
Yeah. I mean, you have to always have empathy and
Yeah.
compassion,
Mm-hmm.
because this is you as the clinician or someone listening to the show may say, I just give it a shot, she could be cured. But it goes beyond just a medical condition.
Yeah.
It's this, as I said, it's distrust,
Yeah.
it's betrayal.
Mm-hmm.
It's feeling, self-esteem goes to the floor. You feel like you're not good enough.
Mm-hmm.
Why would he go there and do that? Not only is he going out doing that, he's not bringing this mess to me.
Mm-hmm. Mm-hmm.
Right? So you have to console, you have to do it with empathy, but you have to also use that opportunity to educate.
Yeah.
You have to use that to educate. And sometimes they bring the partners in and we have a discussion. But Trish, remember, we in 2025.
Mm-hmm. Mm-hmm.
You'll be surprised how people respond, because I know it's a woman's show, But sometime in a relationship, the two of them doing things.
Yeah.
So
No,
no
it's
one can
true.
trace nothing.
Yeah, exactly.
So they'll be like, oh Lord, I hope I ain't get it. He thinking he hope he ain't
Exactly.
give her it. She
Exactly.
thinking she hope he ain't.
No, that's true.
So yeah.
That is true.
So yeah.
Listen, we're
So
gonna
it
take
could go any kind of way
yeah,
in that office.
yeah,
You know?
yeah. But that's a
Yeah.
serious thing, boy. Y'all have
See?
a very heavy task to this that you have to handle and deal with. I mean,
Yes.
because
Yeah.
what Emmanuel did say the in my live read, I did mention that they deal with the mental
Yes.
aspects
So
of
Dr.
things as
Sean
well.
knows who's
Dr.
been on your
Sean
show
deals with that.
before. He
Yeah.
does mental health.
Yeah. So we're gonna take a quick break. All right. So after the break, we're gonna go ahead with these questions because people need to know,
People
right?
need to know.
This the season. This the season, the love season and everything. Everybody romantic and all the
Yeah.
love
In
is in
their
the air,
feelings.
all in their feelings. But we want you to use your head.
Mhm.
This head.
Yes.
All right.
Yes. That one.
The one on the neck. All right, at the top.
Yeah.
All right, right after this. Great. So we're on a break now. Thank you so much for sharing that.
Yes.
And that's something. Well, how much time we have on break? So I want to ask. You have any
Okay.
questions for him? Okay, so the
Mhm.
question I have is I have a lady
Mhm.
that experienced infidelity in her marriage, and she's saying that she doesn't want to continue on being intimate with her husband until he takes a test,
Certainly.
but he doesn't want to take a test.
Oh my goodness.
What are your thoughts on that?
I get that scenario all the time. Now, the man may not want to take the test. Sometimes we always think that he ain't taking the test
Mhm.
because he know he got something.
Mhm.
Not necessarily. He may know that he has been, if it's fair.
Mhm.
Any medical condition dealing with a man, fear prevents us from going to the clinician.
Mhm. Mhm.
I'm a man,
Mhm.
right? And so it could be fair. It doesn't mean that he has anything.
You
It
think it's
could,
pride?
it could be pride.
Yeah.
It could be, you ain't trust me. Why you want me go? You don't have faith in me. He may feel slighted. I'm looking for the word, Trish. Help me.
Mhm. Offended.
Offended.
Yeah.
He may take great offense.
Yeah.
So you want me to do that? We married.
Mhm.
He make that pride, that arrogance. When
Yeah.
that rise up in us
Yeah.
men,
Yeah.
right? And that creates a lot of problems, right? So it is difficult. It is difficult. It is difficult. I don't even have the answer for that. She
Mhm.
can ask, and then again, you do women show all the time.
Mhm.
Now she holds sex from him.
Mhm.
She withholds sex from him.
And
That's
then
another problem.
that's a cycle because
A
he going
cycle.
back out to go finish doing.
Yeah.
But
So you see
yeah,
how
that's a serious thing.
extenuating these sexual sex is,
Mhm.
right?
Okay. Back. Welcome back. For those who are just joining us today, we have Dr. Morgan, Norad Morgan in our building talking about STIs. All right. You have a question? All right. Beats has a question. Beats, put your mic up. Uh-huh.
Uh, Doctor, I have a question, Dr. Laura.
Yes.
So I know in Bahamian, you have this thing that we call a night fever.
Yes.
Is that the same thing as herpes?
Yes. Night fever is herpes simplex 1. Usually
What?
it occurs on your lip. It's very common. If I were to take
Yeah.
all Bahamians' blood, 90% may have antibodies positive for one. Because everyone kiss from your teenager, you're
Yeah.
kissing. Guess what?
Just share a drink.
Adults is
Yeah.
kiss babies too.
Yes.
So that's how it's spread.
Oh, okay.
And so night fever, I mean, it's harmless. I mean, it's transmissible, but it's not life threatening. But herpes simplex 1 is pretty common. So
Mhm.
if you go in any university setting, any university setting, any professional school around December, November, December, or May, June, everyone got night fever
Mm.
because it comes up when you're immunocompromised, and stress could
Right.
immunocompromise. So you could go on any academic campus, college or university campus, people walking around with night fever,
Mhm.
right?
Let's talk about the STIs that are curable and
Yes,
then the ones that are you know, not.
not curable. So the
Um,
curable ones, chlamydia is curable, gonorrhea is curable, um, syphilis is curable, um, trichomoniasis is curable, um, herpes is not curable, HIV is not curable. Um, HPV is not curable. Anything I'm missing? We're missing one or two. You have uncommon ones like LGV. It's also caused by the same agent that causes chlamydia. That's curable. Um, so those are the main. Those are the more common ones that are curable.
We have some questions that are coming in from the Facebook page directly.
Oh,
Yeah.
great!
They wanted to pop up. Someone's asking, does being on the pill protect from STDs?
Being on the pill does not. It protects against pregnancy. And but I hope we get Trish. I hope we get to prevention of STDs.
Yeah, we getting
because
there.
I have
I'm
a lot.
actually heading there
I
right
can't
now.
wait for that segment.
Yes, yes. And that's actually my next question.
Yes.
All right. What are the best ways to protect yourself and your partner from STIs? Obviously, we know what the best
The
way is.
best way.
But then you got some ones who hot up, they ready to go.
And guess
So,
what? The A word ain't gonna help.
no,
Abstinence sound like
abstinence.
that's a term in the 50s.
Right.
They'll look at you like, what? So abstinence is the best way.
Right.
If you ain't having sex, you can't get an STI. You
can't.
can't get it from a toilet.
Hold on.
You can't get it from hugging.
You could still get an STD if you're not being well, what's the best way? Put intercourse. However, let's talk about the
so
oral
abstinence
sex.
from sex. So
Right.
oral sex. And please, Trish, keep me on track. I want to get to this prevention. We got to
Let's
help
go.
some people.
Yes.
But oral sex has a low risk of STDs for most. Now, when I go in high schools, church groups, oral sex, I'm seeing a lot of oral chlamydia and gonorrhea and syphilis. So from oral sex, when females or men who have sex with men who give, receive, who have oral sex, meaning they receive, I guess, you can get chlamydia and gonorrhea in the back of the throat. So I've had many instances where I may be treating a pharyngitis or a tonsillitis, and I think it's just a simple bacterial pharyngitis or even a viral pharyngitis or tonsillitis. And I may be treating with your conventional antibiotics for that, but the person isn't getting better. I've had instances where I've had to ask, and they look at me side eye, but I ask, when asked if you had oral sex, when asked, have you had oral sex? And they'll tell me, yeah, I have oral sex. And then I may go a little further. Did your partner, then they may have had a discharge, something may have not smelled right or something. And chlamydia and gonorrhea, I say that to say, can be in the back of the throat. That's one of the ways you can pass it on. So from oral sex, you could get oral pharyngeal chlamydia or gonorrhea, even syphilis, syphilitic sores.
Are there any
or herpes.
external
No, it
visibility?
may be in the back of the throat, so you won't see it.
Yeah, nothing
And
on
so
the lip.
nothing on the lip. I mean, herpes could be on the lip, syphilis could be on the lip or tongue. That's not a common presentation of syphilis, but it's in the back of the throat. When we look in the back of the throat, we may see what we call exudate. There may even be pus or exudate on the tonsils or on the back of the throat, called the pharyngeal cavity. Or the
Now, I know back in the day they used to say, and I don't know how common it is, right? But they used to say condoms aren't 100%.
Yes. So condoms are not
effective.
100% because remember, a lot of our STIs, Trish, are contact transmitted.
Right.
Something like syphilis. If someone have a syphilitic sore and you just rub up, this is what I tell my high school students and young people all the time. You don't even have to penetrate. You could just come in contact with that sore, that herpetic sore, herpes sore, or that syphilitic sore. You just come and rub up against it. And that's transmission, right? So parts of the penis that are not covered with the condom, and if it comes in contact with that syphilitic lesion or that herpetic lesion, is contact. So, yeah. And HPV is a contact one too, right? So you don't even have to penetrate. And remember, you have oral sex for those younger people listening. Oral sex, vaginal sex, and anal sex is a common one too.
Right.
Even practice within heterosexual couples. And anal sex is the quickest way to get any STD, especially HIV, STI, especially HIV.
How important is regular STI testing? And I know this is obvious, but I have to mention this.
It is very
and
important.
how often should someone get tested if they are sexually active?
I like to test based on risk, perhaps every 6 months to a year if you're not participating in any risky behavior. But then again, you may not know how much risk you're in. Because you, as we said, you may think you're
You
in a
may think
monogamous
you, yeah,
relationship.
yeah.
But for those persons who are high risk behavior, men who have sex with men, every 3 months.
Mhm.
Every 3 months, you should be screened. And remember, something like an HIV test, the test I get today reflects 3 months prior. So you can't have sex today and run to me tomorrow and say, Doc, I want to know if I'm positive or
Right.
negative. It
Yeah.
takes 2 to 3 months. And we're going to get to this, but
Yeah.
I must add that in for the antibodies that we test for to actually develop, right?
Mhm.
So you could test today and think everything hunky dory, and then you are very much infectious. You got a negative test,
Mhm.
but that's not a true negative test, right? So you're still infectious, right?
So talk to us about the prevention.
Prevention. So all STIs can be prevented, including HIV.
Yeah.
So you may have heard of PrEP in HIV, pre-exposure prophylaxis.
Mhm.
PrEP is taking a tablet once a day for high-risk patients. Who are high-risk patients of getting
Mhm.
HIV? Men who have sex with men, transactional sex workers, right?
Yeah.
A lot of that goes on in Nassau.
Mhm.
During the pandemic, a lot of it went on.
Mhm.
People were strapped for cash. They were economically depressed.
Mhm.
So they had to make ends meet
Mhm.
somehow.
Mhm.
And so that's serodiscordant couples. It's just a big term to mean one person is HIV positive and one is HIV negative.
Mhm.
Yes, you do have patients in sexual relationships like that, and both know the status of either.
Okay. Pause right there.
Trish, I know
No,
you was
pause.
going to stop me there.
Woo!
A lot.
Child.
Uh-huh.
And then they still. Ooh. Okay.
Uh-huh.
All right. So let me ask you then. Okay, fine. Because we
So
can.
that's prevention.
Right.
Please, Trish, stick a pin. Ask your question. I
Ooh.
gotta get to prevention.
Okay. Let me go on.
Okay.
I'll
Yeah. Hold,
continue.
hold, hold that
I'll go
thought.
back to that.
So that's pre-exposure
Yes.
prophylaxis,
Yes.
where high-risk groups take a pill every day
Yeah.
to prevent them from getting HIV.
Mhm.
Using a condom, and it also protects you if you don't use a condom,
Mhm.
right? I talk about the high-risk group. Even heterosexual groups are high risk.
Mhm.
You have a lot of men come to me and say, Doc, I ain't a no condom thing.
Yeah.
You have a lot of people, when they travel, they get freer
Yeah.
and they need to be on their PrEP. This is the reality, and people don't talk about this, but this is the reality.
Mhm.
Um, a lot of we think that only men who have sex with men are high risk groups. Heterosexual couples are not using condoms,
Mhm.
and a lot of them have many episodes of condomless sex, so they
Mhm.
are also high risk. If someone come to me every 3 months, this week they got gonorrhea, that next week they got syphilis, then they come up with chlamydia, you are at high risk of getting HIV. HIV is peeping right around the corner. How do you get STIs? From having sex. So if you
Mhm.
could get chlamydia and gonorrhea, you could get HIV. And remember, Trish, a lot of the STIs could predispose you to
Yeah.
getting HIV
Yeah.
because a lot of the STIs have ulcers.
Mm.
Ulcers are the perfect setup for getting HIV
Mhm.
because
Mhm.
they bleed easy.
Yeah. Yeah.
They are a perfect portal for HIV to enter. So you see that
I
relationship,
see it. Yeah.
right?
Yeah.
And so that's prevention. I
Mhm.
want you on your PrEP because you're at high risk and PrEP works. I could give anecdotes. The studies have shown it from 2012,
Mhm.
right? We started PrEP in the Bahamas in 2016. It started in the United States in 2012. But Trish, I thought I thought it was breaking down the doors when we started in 2020. I was afraid the government would not have enough.
Right.
But the
People were
uptake is
actually.
not as good as I want it to be.
Oh.
And we're going to talk about that. It could be stigma. If I take PrEP, man, they must think I's a whore.
Yeah.
Silly things like that, myths and stigma and discrimination. Just like HIV has stigma and fear and discrimination, taking PrEP has stigma.
So what are the risks or the side effects
Of
of
PrEP?
taking right?
You may have some gastrointestinal upset.
Mhm.
The studies have shown that it can affect to a lesser degree. It may cause acute kidney injury, but
Mhm.
once you stop it, that is reversed.
Mhm. What
Right?
about things like erectile dysfunction?
No, it doesn't
dryness for
affect
the
that.
females.
And then a lot of
This is for men
medications
and women.
for men and women,
Yeah.
a lot of medication can be taken with it. So there's no drug interaction.
Mhm.
But I also wanted to say that in men, it gets in your system after 7 days.
Mhm.
In women, it takes 21 days. And so I ask my people, if you know you could do what you could do if you're traveling or you know you're in a risky situation, I have to bear in mind that it starts working within your system within 7 days.
So what exactly does it do again? Just to
It stops the
reiterate.
replication of HIV before it gets to the point where it becomes very infective.
Okay.
Right.
Okay.
So it actually disrupts the replication of HIV by blocking one of the enzymes that HIV needs to replicate to
I
reproduce
get
more of
it.
itself.
I
Now,
get it.
PEP, so that's PrEP, PrEP, pre-exposure. PEP is post-exposure. You had a wild night. You even ain't know if you use a condom. I could put you on post-exposure prophylaxis if you present to me within 72 hours. And you take that for a month. And obviously, when you come to see me, I screen you.
Right.
Right? I screen you for other STIs. I, do basic blood work. You take that for a month, right? Or the condom may burst. These things happen. A lot of people try their best to be careful.
Yeah.
Or the condom may slip off. I had a case yesterday. The condom slip off. Right? I had to give someone PEP. Right? And so that's it.
Lord,
And
it's rough
don't
out
forget
there.
HIV treatment is also prevention. If those who manage HIV patients could get the HIV patients viral load down to undetectable levels, they do not pass it on. When I tell people this, they say, Morgan, stop talking. But it's true. I have serodiscordant couples. They don't use condoms. One is positive on their medicine and their virus is undetectable. They having sex, Trish. And
They living it
5
up.
years, they're living it up, loving one another. This 2025, we have all this at our disposal. And people wouldn't take charge of their sexual health. Other STIs could be prevented.
Yeah.
Syphilis could be prevented. Doxycycline 200 milligrams. We call it doxy-pep. If you take that within 72 hours of a sexual encounter, it prevents syphilis. If you've had condomless sex, you present to your healthcare provider. They could give you an injection. That prevent gonorrhea. Another pill, that prevent chlamydia. Just like doxycycline also prevents chlamydia. Right? And we've talked about HIV prevention. So STIs in 2025 are preventable.
Yeah.
Now, this does not give people the license to go out there and just be
just
indiscriminate and careless sexually.
careless.
But their STIs could be prevented. Yeah, but a lot of people don't know about this, Trish.
Yeah.
And I try my best to tell them about it. And so whoever's listening to this show, put it in your family group chat, put it in your work group chat, and some work groups I know that need to be in the chat. Put it in the chat, because mental health, physical health, there's also sexual health.
Yes.
You have to be sexually healthy.
Absolutely.
STIs cause a lot of anxiety. And if Dr. Knowles was here, we could talk about the interrelationship between any chronic illness, such as HIV, and the psychology of anxiety and depression. When you tell that woman in there, she's been betrayed, she's been, she has an STD and she's been faithful all this time, that's the cause of great anxiety.
Absolutely.
It can make someone depressed. It could actually rip apart a relationship. Right? So don't take STIs for granted. Sexual health is very important, especially in this month of love, where Valentine's night, bring it on Bram. It could be a lot going on. But this talk show comes right in time for people to make sensible sexual health decisions.
Yes, absolutely. I can't agree with you more, because it's like everybody just wilding out. Like the term going raw. You know what I mean? That's what they say all the time. Like, ain't nothing like the real thing. You know what I mean? But it's until afterwards, like you said, 3 to 4 days later, when you're feeling, a little itchy, or what else you say?
Trouble at your door, irritated,
and exposing yourself to all kind of different I don't even know. I try and I getting so flustered now, because the passion is for me is to get the information out.
Yes.
Is to get as much knowledge out there as possible to prevent these things from happening. So having you here, I'm praying and hoping that it gets into the ears of the people that need to get,
especially women too. Remember, I wanted to mention something about women and STIs.
Go ahead, talk about
women. Listen to me carefully. You are a high-risk group. In certain cultures, you're a high-risk group, even in the Bahamas. Why do I say that? It has something to do with anatomy and physiology too. Women could have STIs in in the vagina that go undiagnosed and untreated. Remember, I told you about the relationship with the other STIs and HIV.
Mm-hmm.
If you have other STIs, it makes HIV easier to contract, because if you have STIs in the vagina untreated, the vagina is inflamed, right? It's friable. It can easily bleed. That's
Yeah.
the perfect setup for HIV.
Yeah. Yeah.
Socially, in other cultures, maybe not here, in Middle Eastern cultures with polygamy, where a woman can't open her mouth and say, "I know you got 3 and 4 and 5 lovers."
Mm-hmm.
She can't open her mouth and say use a condom to him. She can lose her life.
Yes.
That makes her a high risk group,
Mm-hmm.
right?
Mm-hmm.
So all of that, gender based violence, domestic violence. Women can't say, "You can't have sex with me tonight."
Mm-hmm.
Although she know he is out there. The
Mm-hmm.
man may have clinical symptoms of an STI.
Mm-hmm.
And in certain circumstances, she does not have the ability to say, use a condom or we ain't having sex. So age and then, we have a population where um, a lot of men have sex with men. They may not
Yeah.
identify as gay
Yeah.
or homosexual, but they have sex with men.
Mm-hmm.
So they may be bisexual or go both ways.
Bisexual. Mm-hmm.
And so the risk increases in that regard. And so a woman becomes high risk in that
Yeah.
regard too,
Yeah.
right?
Is that a question? Go
One
ahead.
question from the
The
Facebook
audience.
page.
Mm-hmm.
How accurate are at-home STD test kits, and which ones would you, as a doctor,
Recommend.
say
Mhm.
are reliable?
Now, a lot have been validated.
Sorry, excuse me. You think the audience could hear what you're saying? Can he repeat? You want to repeat
Yes.
the
So,
question?
so what STI kits for testing you can use at home? Meaning, you
Mhm.
could go to your local
And
pharmacy
how
or
accurate are
order
they?
it online. And how
Mhm.
accurate are they?
Mhm.
I know a lot are validated. I couldn't tell you the brand names. Um, I don't have a problem with them because I know our STI and immunology services have validated a lot
Mhm.
via studies, right? Dr. Nakia Forbes has done a lot of work on
Yes.
this, and she is the authority on HIV in the Bahamas. But I prefer you to go into an office and do your STD screening there, or for it to be sent to a
A
lab,
lab. Mm-hmm.
because it's not just testing. Some people may test at home, something may look right, or something really truly, and they go out there and do fool, violence, suicide, murder, right? Sometimes these tests are not even accurate. I had someone who did a test, right? And I don't know, he thought he thought he saw a positive.
Mhm.
He panicked, and he
Mhm.
was in the States at the time. He called me from there. The man jumped on a plane. He cut his vacation short to come.
Mhm.
And it wasn't so. I did all the tests and he was negative.
Wow.
The test was faulty, right? So it could create unnecessary anxiety.
Mhm.
Now, there's a place for them. So that may just be my personal clinical preference.
Yeah.
But
Come in.
yeah,
Do it
come in
professionally.
and do it. And counseling goes along with it
Right.
too. You
Right.
can't do STI screening without
And
counseling.
just yeah.
You have to have pre, during, and post counseling.
Mm-hmm. Mm-hmm. That's one of my questions. Go ahead, please.
Can I get an STD or an STI from receiving a tattoo or piercing?
Theoretically, a lot of the blood-borne, yes. Can you get an STI from getting a tattoo? I guess
Piercing.
theoretically, you can get some of the blood-borne ones. We think of HIV all the time, but you have to think of other STIs. I didn't mention them, like hepatitis C.
Yeah.
Hepatitis B is very infectious,
Mhm.
albeit we are immunized at birth. And definitely by the time we start school, everyone should be immunized against
Mhm.
hepatitis B.
Mhm.
Remember, hepatitis C does not have an immunization
Mhm.
associated with it, but it is curable, but this is very expensive.
Mhm.
So theoretically, if you're transmitting blood, but a lot of our tattoo artists are pretty knowledgeable and very careful, and they sterilize well. So that's not usually a major concern
Yeah.
about STI transmission.
You can do another question.
Can I get the same STD twice, or am I immune after the first time?
No, you could get it twice, especially with syphilis. Sometimes, yes, you got. Can you get the same STI over?
Mhm.
Certainly. Because you could be treated and go back to the same partner who wasn't
Who
treated
wasn't? Yeah.
and get it. Or you could go to another partner and get it.
Mm-hmm.
Again, I see that a lot with syphilis. You treat them, they're fine. And sometimes you wonder, but the amount of antibodies in your system isn't going down. I know you were treated. And then they would confess, yeah, well, doc, yeah, I've been back. I said, but was he or she treated? No, they won't get treated.
Oh, gee.
Sex is a very strong appetite, Trish.
It is.
You'll be
Absolutely.
surprised. Sometimes we don't really think
Mm-hmm.
when it's a strong appetite. I remember Miles Monroe used to always say there are three big appetites:
Mm-hmm.
food, drink,
And
and
sex.
sex.
Yeah.
Yeah.
So let's dispel some of the myths, because you started off with some, people thinking that you could just. You have another question? Okay, so let me just ask this first, and then we go into the break so
Yes.
that you can answer it. But I want you to dispel some of the myths after our break about STIs,
Certainly.
and then of course you pair it with the truth, with what it is that people out there are thinking
Yes.
or perceiving. All
Certainly.
right, so let's take a break, and then we'll get back to those answers. Some may.
Yeah.
So you said you were you deal with this basically every day. I
Yeah.
mean, how do you deal with the mental part of it, man? Like knowing, like for someone,
It's a mental-
like let's say a 20-something-year-old who
it's HIV positive.
just-
I've had 17 years
Yeah.
HIV positive.
yes,
Could you imagine a teenager, you only live life yet?
no,
And usually those patients, teens, the mental health, and that's why I have Dr. Knowles.
yes,
All right? Because they have to get a mental health analysis.
absolutely.
And thank God we share the same building,
Mm-hmm.
right? And so I could just move. We could
Go
just
right
move.
there.
Yeah.
Right,
we could
go right next
there.
door.
Because they don't handle it well. And so I'm kind of open to it. I know my office say, you give everyone your number. No, I give them my WhatsApp. And I try to talk them through it. I get them the help they need. I'll tell you, come in off record. I'll meet you because it's important.
Yeah,
They ain't start life yet.
no,
And they have to deal with a serious chronic illness. It ain't easy. Some of them are suicidal.
yes.
I've
can
had one
imagine.
say, Doc, I ain't gonna lie to you. I was going to go on the bridge. I telling you the truth, Trish.
Mm-hmm.
Suicide is definitely in their thought
Mm.
because they think their life
is
is
over.
ended.
Yeah,
They think it's the
that's
end.
it.
Yeah.
Mm-hmm.
Yeah. But yeah.
Go ahead with a question.
Someone's asking, how do I bring up the conversation, or how do I talk to a partner about STIs without killing them?
Oh my goodness. That's easy. Sorry. I shouldn't
Go
have.
ahead.
I shouldn't. Sorry, Trish.
How much time we have? Should we? No, that's a
Listen.
really good question that I want on air.
You got 12 seconds.
Okay. Yeah.
So you
we'll
want that
wait.
on air?
No, I'll wait till we
Oh,
get on
yeah.
air.
To repeat the question.
Yeah. I will
Yes.
repeat it.
Yes. So we'll wait till we get on air for that.
3, 2, 1.
Welcome back. We're on our last lap with this particular show with Dr. Morgan, talking about STIs, ways to prevent it, what is curable from what is not curable, how to speak with your partner about issues like this, what are some of the myths, and of course, how to dispel those myths and what's the truth with STIs. Here, especially in this country that seems to be so prevalent. And before we leave, Dr. Morgan, remind me to ensure that you read some of the statistics
Yes. yes.
for us so that we could bring it home. Because
Yes.
people, we hear these things in family education and stuff in schools, and we know this is what happens if you don't use a condom. We know this is what happens if someone actually have an STI, but yet we still go ahead and we allow, our passions to get a hold of us. And so, of course, this show, as I've mentioned numerous of times, is intentional,
Yes.
especially for this month. So while we were on break, we wanted to hold this question for the radio listeners as well. We didn't want to keep it just for the social media listeners. But the question was,
Yes.
question
The
again?
question was, how do I talk to my partner
right,
about STI
without
screening
killing the
without
mood.
killing the mood
Yes.
or running them away?
Right.
Easy. You have to now look at your life and your health and this person. Sex is a strong appetite. Yes, you may love, the mood is right. In fact, you shouldn't be in that mood in the first place until you know the sexual status of your partner. I tell young people all the time, you're starting a new relationship. You know well that this is going to end up sexually. My God, it only take a day or two to get results back. The two of you come together and say, you know what? And you could say, I don't play that, I mean, if we could deal, we got to know each other's status. That's just how I roll.
That's a
And
part
just
of
let that
the
out right at the,
relationship.
yeah. Don't let nothing run on.
Yeah.
You're done in the bed. You're under the sheets. The candle going. You see February 14 coming up. This is the perfect time to get this out the way. The mood is right. You have a little drink in your system. It's hard to it's hard to back out of that at that point.
After that
That ain't
point.
no time to be talking about STI screening.
No.
You should have done that before.
Yeah.
It is not a difficult conversation, right? It is not a difficult conversation. If you know you're going to be sexual, you could get you could get an HIV test done in a rapid HIV test in an office in 10 minutes, 15 minutes, right? Right? If you're in a sticky situation and you just met someone, use a condom. Use a condom. But STI screening should be an easy conversation because your life and sexual health at stake. Shouldn't be difficult at all.
Absolutely. So let's talk about dispelling myths.
Yes.
Give me a few of them that you're hearing out there, especially in our country.
Yes.
With STIs. Oh, child, I ain't gonna get it if I do this, or I could get it if I do that.
Yeah.
Let's dispel some of them.
I ain't gonna get it. One of the myths is you could get STIs from using a toilet seat. You could get it from using utensils in the house. Some of us may have HIV positive family members. You can't get it from drinking from the cup, from eating from the food, same spoon. You can't get it from using the same bath rag, from using the same shower, right? You can't get it from using the same toilet seat. You could get it if theoretically blood is around.
Right, I heard about a toilet seat.
Don't use the same shavers.
No,
you can't get it from a toilet seat. All right, and so that's a myth. Also, another myth says, man, I can't get HIV from pre-cum. Yes, you can get it from pre-cum. Pre-cum can have HIV in it, right? Man, I can't get it from oral sex. Yes, you can get HIV. It's very low, but there's a theoretical risk, right? So those are some of the myths, If I pull out and don't come, you can't get an STI. I mean, these things don't make much sense.
Right.
And so there's a lot of myths. There's a lot of myths around. So those are some of the more common ones that I hear. Yeah.
You said you have another question because I'm about to ask another question now.
Yes.
Go ahead.
This person says, what is the deal with superbugs and antibiotic resistant STI? Is that a real thing?
Yeah. So what is the deal between superbugs and antimicrobial resistance? So antimicrobial resistance is a real infectious disease issue. I do not think in our culture we have resistance against the antibiotics we use against our STIs like syphilis. I don't think we have penicillin resistance and the resistance. I don't think that's a national problem. It may be in other parts of the world, and it may be with other superbugs, not STIs, right? It may be, in other infectious disease circumstances.
I know you at the beginning of the show, we were talking about the presentations for men.
Yes.
Males. I don't think we covered females.
Yeah.
You want to go through that for me?
So females, you may just have fever. You may have some lymph nodes. You may not see the discharge, but you may just feel unwell, right? You may just feel like something wrong, or you may have pelvic pain. We have something called pelvic inflammatory disease. Chlamydia is one of the cause. Gonorrhea is one of the cause, where the patient could become very sick. They could have, on an ultrasound, you may see pus in the abdomen, fever, vomiting, diarrhea, severe abdominal pain, right? And so females like this need to present to their healthcare provider. It could be other things, but pelvic inflammatory disease is also
type of
And discharge, of
lesions,
course. Yeah.
right,
Yeah.
around the
So
vaginal area, no, like
it may
bumps.
not be coming out,
Right.
but when the clinician does a use the speculum
Right.
and does a proper vaginal and cervical exam, you may see it then.
Can we talk about it? Can we talk about the steps and procedures when coming to Emmanuel Medical Center? Like
Yes.
what are like, as soon as I walk in the door
Yeah.
and I want to make sure
Yeah.
I want to find out if I have an STI,
Yes.
what do I do? I walk
Yes.
in,
Yes.
I shame because I almost say I come for
Yeah.
STI
Yeah.
testing. So do
Yeah.
I write it on a piece of paper? What am I doing?
No, no, no.
Right.
Everything is done diligently
Right.
and with the utmost
Right.
confidentiality. We have trained healthcare providers. The nurse that works with me,
Mhm.
she is trained in infectious disease nursing,
Yeah.
and so we know the steps to take to ensure confidentiality,
Mm-hmm.
to allay the fears
Mm-hmm.
of patients, the anxiety of patients who come. Everything is done um, in private, in confidential,
Mm-hmm.
and in confidentiality, and so you have no fear of that. And
Mm-hmm.
then at Emmanuel, so much goes on. Patients see me for pressure.
Various
Patients see me for
things.
sugar.
Mm-hmm.
I see children. I see all conditions there,
Mm-hmm.
not only
So
STIs.
a person comes in, a male or female comes in,
Yes.
they say exactly what they
Now
want
they
to
may
the
not tell the nurse.
receptionist.
They may
Right.
not tell
They
the
just say
nurse.
checkup.
So they usually just talk to me directly. So I don't mind that. You don't have to divulge.
Right. But you
When you
come in
come,
and saying you come in again to check up.
just check up.
Yeah.
That's all I need to know.
Yeah.
But when I get you in a confidential,
Right.
private space,
Mhm.
a safe space, we can now have that conversation.
Okay. So the person is now, they already did all the paperwork, whatever, all of that,
You just tell
insurance.
the nurse you came for a checkup,
Right. Then they come to you.
and they come to me,
Let's
and you could
continue
tell
with the
me
steps. So
everything.
let's say someone says, okay, I just, because you said it doesn't really show up until like 3 or 4 months.
Yes.
Okay, doc, give me one of the things. I have discharge,
Yes. Fever, pain,
fever,
burning when I
pain,
pee.
anyone, whatever.
Yeah.
What is going on with my body?
Yes.
So once that is disclosed to you,
Yes.
what do you do next?
Well, I have the conversation. I take the sexual history.
Mm-hmm.
And the sexual history is very important, right? Because it tells me about risk and behavior.
Mm-hmm. What are
Right.
some of the questions you ask?
I may ask, when last have you had sex?
Mm-hmm.
What kind of sex do you have?
Mm-hmm.
Do you have sex with men?
Mm-hmm.
If it's a guy, do you have sex with men, female, or both?
Mm-hmm.
Right. I may ask, are you using protection? Or on your last encounter, what kind of sex did you have?
Right.
Did you use a condom? Right. How long between that sexual encounter and how long was it between the sexual encounter and when you first started experiencing the symptoms?
Mm-hmm.
Yeah, that gives me an idea,
Mm-hmm.
right? And then I tell them what it may be. I tell them it's curable. I ask them about partners, right? So I do my own contact tracing history.
Mm-hmm.
I ask them about partners. I always give them the option to bring their partner in to be treated.
Mm-hmm.
I treat them. I have a counseling session with them.
So hold on, there are no blood works, no testing.
Yeah. Well,
Right.
yeah. So
Yeah.
I'll do blood works. You may do urine test. You may do a swab.
Right.
You may do blood test. You may do urine test. Now, a lot of the STIs may not need testing
Right.
because it's the clinical presentation is clear.
Okay.
Right.
Mm-hmm.
So you may, for gonorrhea, chlamydia, it's pretty clear cut. You may give a shot in the tablet, and that usually clears it up. Now, if they don't
And that
resolve,
one time.
yeah,
Mhm.
stack.
Mm-hmm.
You see, and it's curable,
Mm-hmm.
but they may not resolve, and that is when you may have to do testing. Now, some people say, "Doc, I still want to know." You send off the urine, right? Or you may decide to do the urine testing,
Mm-hmm.
right? Sometimes it may not be clear what's going on. You send off the urine testing for
Mhm.
gonorrhea and chlamydia,
Mhm.
right? And definitely counseling, prevention, and partner disclosure, and partner education.
That's vital. And I have to stress the fact that even though one person went in and they found out what's happening, and you're still with that particular partner, for goodness sake, please convince the other partner to come in as well.
Yes.
Because as you've stated, you've been there, you didn't get the shot, and you're thinking everything fine
but
and
you
you're
could go back and
cured,
get it.
then you go back and get the same thing and over again.
Yeah.
Because I've learned some things today. One being these things can actually, I mean, they lead ultimately to death if they're not curable, or if you feel
Certainly.
as if, okay, well, it's fine, I could just go ahead without it.
Yeah.
And then once again, you have people who are prideful or embarrassed to
Yeah.
even go
Yes.
to find out that
Yeah.
they have
Yeah.
these things.
Yeah.
And so you want to be able to take care of your sexual health. That's
Yeah.
the whole
Yeah.
purpose of the show
Yeah.
today.
And you may have a primary healthcare provider who you're comfortable with. Go to them.
Yeah.
Yeah. Just tell them. I mean, doctors, we see it all. You can't be embarrassed of us.
No.
We want to help you.
Hmm.
You know.
So is there anything, Doc, that we may have missed out that you want to share?
Well, I just want to impress on persons. Yes, you're checking your cholesterol. You're always checking your pressure.
Mm-hmm.
You're always checking your sugar. You have to do your STI screening. You will not know if you have an STI, and some STIs can be life threatening. You won't know if you have an STI if you don't check, right? And NHI affords you the opportunity to do your STI screening at your annual visit. That is such a blessing. It's such a blessing. So, and that is included in that visit. Do all say, Doc, man, take everything off.
Okay, so I have some questions here that I'm gonna ask you.
Certainly.
From WhatsApp, actually. Some people WhatsApp their questions. I guess they want to remain anonymous.
Yes.
How do I explain to my kids about STIs without scarring them or scaring them, or giving them too much information?
Trish, this 2025. These children know a lot already.
And they can go online and go look for it.
Okay,
even if
then.
you don't tell
So
them.
all you gotta do is tailor it.
Right.
Just have a good and I love relationships, and I've seen a lot of parent-children relationships where you could have these conversations. I know a lot of children, even males, especially males with their mother. I have a lot of them. The parents that say, "But Doc, I feel so embarrassed. He's coming, be showing me everywhere." I say, "That's great. He's telling me everything." I say, "I don't want to hear."
That's a wonderful
That is a
relationship.
wonderful open door
Yes.
to have the conversation. Because children who hide and children who are cagey, you can't get sometimes you don't know what's going on with them.
Yeah. Yes.
And they're not going to divulge. And then that inhibits you from having the conversation with them about sex. Just talk. If you all have a good relationship, and don't be don't condemn them, and don't be, what's the word? Trish, you good with words. Don't be condescending, and don't be
too strict on them
strict
and
or
having them
condemning.
feel,
There's a word
and
preachy.
preaching to them.
Yes.
Making them feel bad and condemn. Yeah, I get it.
Just have the conversation.
Yeah.
They know better,
Yeah.
They're hearing it in school. This is 2025.
Absolutely.
I don't care how nerdy, how cagey the conversation. They may not be a part of the conversation, but the conversation is happening around them in school. So they know your job is now to kind of clean that conversation up, but give them the pertinent information that they need about good sexual health.
I love that.
Don't be cagey about it. You got to talk, because you could be saving their life. 15, 16, 17-year-old people are having sex, and they're having sex with older partners.
Yes.
And they're using protection. We live in a transactional society. People doing things for money. This ain't nothing new. And if the money right,
they're gone.
So we have to be very careful. And please, parents, have a conversation about that too. Older partners, the transaction of money and things, we have to also be careful of that. People don't like talk about these things, but that is an open door for STIs.
Absolutely. My other question here is, what's the best way to protect myself from STIs if I'm dating again after a long-term relationship?
So after a long-term relationship, I'm seeing a trend now. So a lot of people come in and they want to get a full STI screen after they've ended a relationship. So what you can do is when that relationship ends, because for some reason during the relationship, no one want to be tested. Anyway, that's a whole different discussion. But at the end, do all of your testing. It's almost, they actually feel like I'm starting afresh. It's a new beginning. So do your testing. And when you start the dating scene, make sure the partner does his testing. Do not be afraid to have the conversation. Your life is at stake. Well, I know someone who ain't afraid now. They'll say, bro,
if you want to be with me, you go.
Let's go.
Let's go.
And quick. And I want to see it now.
Yeah.
Yeah. So, and I think those candid, open discussions, this is sex. Sex is
Yeah.
very intimate. You're
Mm-hmm.
giving yourself.
Mm-hmm.
It is an intimate thing. You can't
Exchanging
be you
bodily
yeah,
fluids,
you can't
and it
be
goes
casual
beyond
with
that
it.
because it's also spiritual.
It's
It's
spiritual. That's a whole
everything.
different
That's a
discussion.
whole right. So you
Emotional.
could at least protect yourself.
My goodness. So this is
Yeah.
serious. Don't be
Mm-hmm.
trivial about it.
Mm-hmm.
Right?
Mm-hmm. Here's the another question here says, what's the difference between an STD and an STI, and why does it matter?
So STDs are STIs. The name was changed to STIs.
Mm-hmm.
So sexually transmitted infections. And
Mm-hmm.
infections can cause diseases. Right? Right.
Okay, this is the last question. I'm not going to ask any more after this. Okay. So there's another one that came up. It says, how do I know if a potential partner is being honest about their STI status?
You could only tell if you have seen the results with your own eyes.
Mm-hmm.
Don't take word of mouth, because I've had circumstances where people have taken word of mouth and it wasn't true.
Mm,
You are a couple. You're going to be intimate. You have a relationship. Go together, talk together, go together and get tested. Now, remember, a healthcare provider cannot tell the results to the other partner.
right.
But in my presence, you guys could share. You
Together.
have the results.
Mm-hmm.
You can now share amongst each other in my presence
Mm-hmm.
your results.
Okay. So those.
Yeah.
The,
And I
I'm
do have a
not
lot
taking
of
any more
couples who see
questions.
me all the time.
Mm-hmm.
It's becoming a trend. It's getting better, Trish. It's
Mm-hmm.
becoming a good trend.
All right. So if someone tests positive for STI, what should they do next?
Hmm.
Did I ask that or did you answer that? How should couples approach a conversation about STI testing before becoming intimate? You already answered that.
Yes, yes.
All right, so that's it. And any last remarks or final remarks that you
Yeah,
want to share
yeah.
to those listening? Because like you told me earlier, you said it was the prison officers who
Yes,
tune in.
yes,
So
yes.
you
Prison
want to,
officers tune in, police officers tune in.
yeah.
They love your show.
Thank
I,
you,
I tend to have casual conversations all over,
thank you.
and and
I want to make sure everyone knows.
yes,
Because
everyone knows.
this is information for everyone, you
Yes,
know.
yes, yes, yes,
And so thank you so much for being a part of the show. But any final remarks before we close?
yes. Test, test, test. If you don't test, you'll never know. Right? Your life depends on it. Your life depends on it. You're taking pressure and diabetes and high cholesterol seriously. Why you ain't taking sexual health seriously?
That's it right there, Doc.
Right?
That's it there. That's it right there. And I think you, especially for those who are going back into the dating pool, you have a right to know. You have a right to know what this person's sexual health or status is, if because it's your body.
Mhm.
You know what I mean? So if the person has a problem, this could be a reason for you to break a relationship or to end that relationship. If you haven't been intimate as yet, and you want, before getting into it, or if y'all are planning or talking about it, you know what I mean, something like that. And then also, if you're in a marriage and you find out that your mate um has betrayed you, or committed adultery, that's another thing. Don't just take it to say, okay, well, they did it, I forgive, and then you don't go and check your status, because that's still your life.
Yes.
So I wanted to place emphasis on those two things. Not that I would try to say go ahead and be intimate outside of marriage, because at that
That's a
certain
whole different
principles and
problem.
standards I maintain on the show. However, people still do things,
Yeah.
and they
Yeah.
I'll leave that there.
So Valentine's Day is coming. Make some good sexual
Makes
decisions. Because guess what?
health
Gifts flowing, flowers flowing, chocolate flowing, everyone in their feelings. Anything could happen.
anything could
Just
happen.
just make
Yeah,
sound
make
sexual
sound
decisions.
decisions, and that's the best thing I could say. Because what else could you say? You can't pound a Bible in nobody's head.
No,
All right, you
no,
can
that don't
give,
even
hey,
work no more.
what we want to say is that the best way for those who tuning in, who are like-minded, who are believers, who tuning in to the
Yes.
show, and that you want to keep yourself until you get married.
Yeah.
As a principle, this is a principle that you may go by. Then go ahead and wait. You want to wait no matter what. If you want to know what the best prevention is, that is the best prevention. Okay. And so I just wanted to stick that in there because of my principles. I
Yes.
wanted to share that. But of course, this information is for everyone, to ensure that, hey, if you're going to go and I wouldn't say fornicate because I don't want to condemn nobody either, right? But if you want to be intimate and be out there, please go
Be safe.
get
Yeah.
tested and ask your partner to also do the same. All right. As the founder of Your Lane Life Coaching, I'm here to help you build stronger, purpose driven relationships. Whether you're single, dating, married, or rebuilding, I'll guide you through effective communication, deeper connections, and aligning with God's purpose. All right. Ready to take the next step? Just go to my website, www.yourlanelifecoaching.com, or give us a call at 376-8689 today. Thank you to Your Lane's talk show sponsors. We have John Shoe Store and Accessories, Your Lane Life Coaching, Emmanuel Medical Center. All right, that's the place to stop to when you go there. Ask. All right, I can tell you, you can well, I like Dr. Nose too, but he doesn't really do the STI
I hope
screening.
you ain't like knows better than me, you know.
No,
So.
I like a 2 y'all. I gotta
Oh.
have a 2 y'all. 2 y'all. I want a 2 y'all on one of these
Trust me,
days.
that's my high school
Please.
best friend.
Okay?
We went to high
Because you
school.
want, if we're gonna do a part two for STIs, you want to be able to talk about us as you've already shared, ways to prevent. And then you want him on board to talk about the mental state and the emotional state of this after you've discovered XYZ. So both of you, you've been wonderful. For those who don't know, Dr. Knows has been
Knows.
on the show talking about mental health. I think it was last year, January,
Yes.
if I'm correct. If not, we can look it up and we'll talk about that later. All right. They specialize in annual physicals, health certificates, and the management of hypertension, diabetes, and cholesterol. They also provide child and adolescent health care, primary health care for adults, screening and management of sexually transmitted infections, and diagnosis and treatment of mental disorders. For compassionate and comprehensive care, call Emmanuel Medical Center today. Now, they may give you $1 off if you say you listen to Your Lane Talk Show, especially if you have to pay co-payment or you ain't get no insurance. So I heard your show.
We work with you.
We work with you, okay? Just say you heard Dr. Morgan or you heard Dr. Knowles on Your Lane Talk Show. They'll take $1 off for you, all
I
right?
know my office
Okay.
manager probably listening and saying, "What you doing?
What you doing?" They're not gonna do it. I'm kidding. All right. Now I ain't getting y'all in trouble. They sponsoring me, so they can eat that $1. So never mind. All right. We're also brought to you by give them a call. 393-9355 is the number to call for Emmanuel Medical Center. Definitely go get tested. And obviously, you've seen the about amount of information and the insight that Dr. Morgan has and what he's given to us freely. So, of course, you want to go there and get more information. If you have any personal questions, go ahead, make an appointment and get that information. All right, and get tested. We're also brought to you by Dairy Queen Bahamas. Love is in the air at Dairy Queen. Spend just $10 and enter our sweet love giveaway for a chance to win amazing prizes. Prize 1 is a free DQ Classic or Red Velvet Blizzard Heart Cake plus a box of healthy dilly bars. Prize 2 is mini heart-shaped Red Velvet Cake. Prize 3 is a box of heart-shaped dilly bars. Winners will be announced on February 12th, 2025 at 1 p.m. on DQ Bahamas' social media platforms. Don't miss your chance to share the love this Valentine's season. We're also brought to you by the Perfume Bar and Lysol Disinfectant, brought to you by Thompson Trading. Thank you so much, Dr. Nord Morgan, for being a part of Your Lane Talk Show.
Thank you for having
And
me
thank you,
again.
Dr. Knowles and Mrs. Knowles,
Yes.
for enduring my calls and my emails. I'm grateful because I wanted to make sure that this took place and it had to have been with you guys. It had to have been with Emmanuel Medical Center. I couldn't go with anyone else.
Thank
I
you
just
so
couldn't.
much.
Yes.
Thank you so much. Thank you.
Thank you for your professional team.
Yes.
They are phenomenal. To Your Lane's continued listening audience and first time listeners, thank you so much for tuning into the show. Please follow the page Your Lane Life Coaching on Facebook, or you can go to Coach Trish Hanna on YouTube to watch the previous shows. And when you do so, please like and subscribe. I pray that you were all empowered, educated, and encouraged today. And until next time, ladies and gentlemen, have a beautiful Sunday. Bye bye.